Nick again here. What I wanted to speak to you about today is a little bit about my story and how I came to be here on beautiful Scarborough Beach, as you see behind you. So I've been in the area for about 12 years and I've had my clinic the whole time. So I left university. I didn't really know what I wanted to do, but I knew I loved helping people and I loved the social aspect that physio had to offer. I knew I didn't want to work in a hospital because I wanted to work in an environment that was uplifting, where we're helping people get better. And a lot of my experiences in hospital didn't reiterate this. So there was an opportunity. A clinic was for sale in Magellan Medical Centre on Scarborough Beach. So I came up, I had a bit of a look. This is back in 2004. And the doctor who owned the clinic gave me an opportunity. So I moved into the clinic. I really enjoyed it at the start. I was trying to build up a really good caseload of patients who I was helping. And yeah, this consumed me for probably 4 or 5 years. Now over that time I got better as a physio, but I also did discover that there was a large proportion of people with more severe pain and severe problems that I couldn't really help. I didn't have a mentor at that time, and I thought, looking back, this was one of my big failings, is that I wasn't having any help from anyone or anyone to show me how it was done. So I started to become a little bit frustrated. Now, back in 2007, a guy walked through my door. He was a financial advisor, and he spoke to me about this wonderful scheme that he was part of, which I signed up for. Now, that scheme was something called Storm Financial, and Storm Financial was one of the biggest failed investment schemes during the GFC. And at this time, I lost my life savings. So, yeah, needless to say, I lost a bit of enthusiasm for life in general. But, out of a situation of dissatisfaction, what happened was it really made me think. I wanted to do 2 things. Number 1, I wanted to learn how to help these people that had really severe pain. And number 2, I needed to learn how to run a proper business, because I realised that, next time I earn some money, if I put it in the stock market, it might go the same way as the first time. So I started doing a lot of education in around 2008, both in a physio and a business setting. So the education I've done in a physio setting has led me to the point where in 2014, I wrote my first book, which is called Why Am I in Pain? I do a lot of mentoring for young physios. We have young physios and physio students come through our clinic. We've had physio students do their 4-week clinical placements, which they do in the final year of their degree. And one of my goals is to employ as many people as I can, both clinical and non-clinical staff from the Redcliffe Peninsula. So education is a very, very big value of mine, as is self-improvement. Now, from a business side of things, my business around the time of the GFC, it was just me. Now, I took on my first staff member in 2008, who's Kate Elliott, who's my head receptionist. And since then, we've grown to a team of about 15 people. So out of that period of dissatisfaction came for me that the thing I really didn't enjoy was working by myself. And I love coming to work every day and having a wonderful team of people around me to share my enthusiasm, and for me to transfer my energy and my knowledge to, and for me to learn things from as well, and challenge me and make me be a better boss. So that's part of my story. That's how I came to be here today. And I look forward to telling you more about it over the coming weeks.